Hey everyone, and welcome. Today we're jumping into a topic that is just so incredibly common in healthcare, IV therapy. But we're going to get specific and break down the common problems that can pop up, and most importantly, the signs you absolutely need to know. So let's get right into it. IVs are literally a lifeline in so many situations, but they're not perfect, right? Things can go wrong. So what are those red flags? What are the warning signs we should all be looking for? And it doesn't matter if you're a patient, a family member, or a clinician. Knowing this stuff is key. All right, first up, we're going to tackle one of the most frequent issues. The easiest way to think about it, it's just a leak. The technical term for it is infiltration. So, what exactly is infiltration? Well, it's pretty simple, really. It happens when that little IV catheter slips out of the vein, and all that fluid that's supposed to be going into your bloodstream, it starts leaking into the tissue around it instead. It's basically an internal leak. Now, to make this super clear, we're going to use this simple framework for every complication we talk about today. What do you see? How do you act? And how do you prevent it? So, for infiltration, what you're going to see is swelling. Maybe the skin looks kind of pale and feels cool to the touch, and it might be painful. The key is to act fast, which we'll get to in a sec. And prevention, it really comes down to best practices, like making sure you're using good sites. Okay, so you see it happening. What's the game plan? It's a really clear step-by-step process. First things first, stop the infusion and take out the IV immediately. Second, get that arm elevated. That's going to help with the swelling. And third, you'll want to apply a warm compress. And of course, the IV has got to be restarted, but somewhere completely different. Next up, we're shifting gears from what is basically a plumbing problem, a leak, to a biological one. We're talking about your body's own inflammatory response. And that brings us to two big ones, phlebitis and cellulitis. So phlebitis is when the vein itself gets inflamed and angry. And cellulitis, that's when that inflammation starts to spread out into the tissue around the vein. Both of these are your body waving a big red flag saying, hey, something's irritating me, or even worse, there might be an infection starting here. Now, what's really interesting here is what to look for. You'll see pain and redness, which sounds a lot like infiltration, right? But here's the absolute dead giveaway, warmth. The site will feel warm, maybe even hot to the touch. You might even see a fever start to pop up. The action plan is similar. Stop the IV, apply a warm compress, and so is prevention. It's all about careful technique. And I just love this quote because it hits the nail on the head. We're not talking about minor discomforts here. These signs are your body's alarm bells screaming that something needs attention right now. You just can't ignore them. Okay, our final complication is one we have all definitely seen before, probably on ourselves. It's the classic bruise. The official name for it is a hematoma. So how does a hematoma happen with an IV? Well, think about it. When that catheter comes out, it leaves a tiny little hole in the blood vessel. If there isn't enough pressure applied right away, blood can leak out from that hole and start pooling under the skin. And voila, you've got a bruise. So, back to our framework. What do you see? Well, you see a bruise. Pretty obvious. But how you act is totally different from our other examples, and this is crucial. You're going to apply a cold compress, not a warm one. And prevention? It's simple, but you have to do it right. Apply firm, direct pressure right after that catheter comes out. And let's just pause on this because it is so important. Warm versus cold. Why the difference? Well, for infiltration and phlebitis, you use warmth to open up the blood vessels, to increase circulation and help your body reabsorb all that leaked fluid. But for a hematoma, a fresh bruise, you want cold. A cold compress constricts those blood vessels, which helps stop the bleeding and keeps the bruise from getting bigger. So, we've gone over what can go wrong and what to do about it. But you know what's even better? Stopping these things from ever happening in the first place. So, let's talk about the golden rules for great IV care. And if there is one single number to take away from all of this, it's this one right here. 72 hours. An IV site really needs to be rotated every 72 hours. Leaving it in one spot for longer than that just dramatically increases the risk for all the problems we just talked about. 72 hours is the magic number. And on top of that 72-hour rule, these tips here are your best defense. And they're pretty universal, right? It all starts with the absolute basics. Wash your hands. It's also about being smart with where you put the IV. Trying to avoid places like the lower legs where circulation isn't as good. It's also about not leaving that tourniquet on forever. And like we just said, always applying firm pressure after it's out. So we've covered the what, the why, and the how. And honestly, just knowing these signs is a huge step. But knowledge is only part one. The next step, and maybe it's the most important one, is speaking up. Whether you're the person getting the IV or the person giving it, vigilance and communication are what really keeps people safe. So the question I'll leave you with is this: how can we all, every single one of us, contribute